I would just like to acknowledge the traditional owners of the land on which we meet and the respect for emerging past and present elders. Unlike the fictitious Shoalhaven of the Australian novelist Judy Nunn in her book Sanctuary, Marg and I are here representing the Elder Abuse Prevention and Awareness Network of the real Shoalhaven. Like Nunn's Shoalhaven, ours is also a beautiful area, but unfortunately not immune to the ugliness of abuse. The extract at the top of this slide is from the Shoalhaven City Council website and captures the environmental features that attract people to the area. Shoalhaven boasts over 100 beaches and 10 national parks. At its centre is Nowra, which is located 160 kilometres south of Sydney, where we are now. Other main towns in the Shoalhaven include Berry in the north and Ulladulla in the south. Additionally, there are about 40 small villages scattered throughout the region. The population is 101,777, and we are fortunate to enjoy significant space, but of course not blessed with good public transport infrastructure. The train line stops at Bomaderry, north of Nowra, and bus services throughout the region are limited, to say the least. Such a beautiful region has long attracted retirees, and this is reflected in our ageing population. 24.5% of our residents are over 65 years of age, compared to the New South Wales state average of 14.5%. This number is expected to grow throughout the next 10 years, and this is quite evident by the number of housing estates that we are seeing multiplying through the area. This is just a graphical representation of those statistics. So the Shoalhaven Elder Abuse Prevention and Awareness Network came to be after an aged care forum that we held. The local health district tries to facilitate these sessions for local health professionals. Marg presented at that symposium on elders' abuse, and from that there was a lot of interest generated in ongoing education. So we worked with the Elder Abuse Hotline, and they were able to facilitate a training session in the Shoalhaven. It was well attended, and after that session we sought expressions of interest for people to join a network. The membership expanded over the following year and has been stable over the past 18 months. Unfortunately, to date, we haven't been able to attract a community representative. The network achievements to date have been that we've had regular network meetings. We started off with monthly meetings, but we've now pushed them back to bi-monthly. Early on, we developed a term of reference with 4 key areas. We've done community sessions, we've done professional education, and we've developed a brochure and poster. And Marg's just going to talk about our most current actions. Thank you.
Problems of being short. So basically what we found was there is an actual increase in demand for our services, and it came to us from the fact that residential aged care facilities and aged care assessors and community providers were actually referring people to us. And I noticed in about a 2-week period I had been a person who was blind had been referred to me, or partially blind. Her son had taken $1,600 out of her bank account. Another person was referred to me by an aged care provider. It's important to recognise the significance that aged care providers do play in referring people to us. In this particular case, there was $40,000 missing from a bank account over a 12-month period, and a $150,000 bond that had been refunded to the estate hadn't appeared to be there. And, you know, even just something simple like a man spoke to his aged care worker and said, look, I think I've been ripped off by my children. And so what we did was we started to think, well, you know, what could we do as an elder abuse prevention network? We did have a look at some of our stats, and the stats I've got up here are the Seniors' Rights Service and the Shoal Coast Community Legal Centre, and they go from 2016 to 2017. You can see the obvious increase there. The Shoal Coast, though, did see a slight decrease. 19% of their inquiries were about elder abuse, and they dropped down to 17%, but, you know, 2% isn't that much. And you have a look at the resources that we have down on the Shoal Coast and in the southern area. The Seniors' Rights has one regional worker, that's me, and I'm a full-time advocate, and I cover from basically Kiama to Eden. The Shoal Coast Legal Centre has 4.6 full-time solicitors, and they cover from Berry to Eden. And so even though there is a lot of you know, there are resources down there. What we're sort of looking at is how can we increase the resources to actually look at this elder abuse, and how can we do something about it and provide the facilities that are needed. So what we actually had a look at was, you know, what are the problems for our area? And you know, unabashedly, we're flogging regional problems here today. And obviously the lack of transport and social isolation. A couple of cases that came to me recently is where the older person needed to get in to see a solicitor, had an appointment to see a solicitor, and the only person they had to drive them to that particular appointment was the child who was doing the abusing. So they had to get the son to drive them with the papers to the solicitor. There's obviously the vulnerabilities, you know, capacity. We've all seen it, older people with paperwork, and they're trying to juggle it and sort it out, and it just becomes a mishmash. Whereas, you know, if there was someone there helping them, it would be easier. And of course, the real problem, all of us provide phone services, but how do you ring up if you're deaf? These are issues that are really important that we had to address. And the other thing, and we were looking at this as a network, and of course the other thing was that the care workers, they need to be informed as well. There was one incidence of us reported to us about a care worker who had not reported elder abuse. It was verbal abuse because she thought she'd signed confidentiality and she wasn't meant to reveal anything that she observed in the older person's home to her employer. And so she didn't report the abuse because she thought she would be breaking confidentiality. So these are all issues that we tried to address. So what do? Basically, we had a two-pronged approach, and Seniors' Rights Service and Shoal Coast, we sort of got together and we thought, well, we need to be doing more about training the care professionals, and we need to be doing more about the provision of home visiting services. And certainly one thing that's come out to us is that face-to-face support is a key issue in addressing elder abuse, especially in regional areas, because it's very difficult for elderly people to actually get to meetings and appointments. And if they are frail and isolated and vulnerable, you know, that is the key factor. So we're trying to increase face-to-face support for the older person, and we're trying to increase the knowledge of the care workers who are working there. We did put a survey out. Next one. Thanks. Oh, you can't get good help, can you, these days? So our survey basically went out to care workers and community workers. 63% said they had, you know, observed or suspected elder abuse. 60% felt that there was inadequate information. They didn't know what was available, and they certainly didn't know how to access it. Then, of course, 81% said, yeah, look, we would really like further training. So that's what we looked at. And Shoal Coast Community Legal Centre has put in for some domestic violence funding, and they're going to use some of that funding to try and increase the face-to-face support. One example we had recently was where a lady reported that physical abuse from her daughter. She lived with the daughter, she shared a home with her daughter, and the only time she was free was Mondays, because that's when her daughter worked. But it was the one day of the week that the Shoal Coast Community Legal Centre had no one available to go out and visit her. So we were stuck. There was a real conundrum, and basically we had to get another daughter to come down to take her in. So, you know, that is important. We're using this as an ongoing thing. Certainly Shoal Coast Community Legal Centre is referring people to Seniors' Rights Service, although we, as a phone-based service, has its limitations. But we did have one example where they referred someone to us in aged care to look at the contract of a home care contract, and our solicitors were able to help. So we're working together, but, you know, the key thing is this face-to-face. The only problem is, to get more funding, you have to have the stats, but to get the stats, you have to have more funding to provide the services, and it's a real spiral that we haven't yet managed, a conundrum that we haven't managed to solve, but we're working on it. Thank you very much. Just because we come from the Shoal Coast and it's beautiful, we thought we'd remind you of it all the way through the presentation with lovely beach scenes.